Good afternoon, dear colleagues. Today I want to represent my topic, the influence of the immobilized subtilisins on the coronary blood in experiment. The circulatory system diseases take a leading position in their worldwide. The largest percentage among them is a coronary heart disease, including angina pectoris, myocardial infarction, and sudden cardiac death. Today, it is actual to search new drugs with the coronary dilating effects, as well as to establish the effects of known and registered drugs on the coronary vessel. In Russia, the drug Trombozim is registered and used. The active substance is immobilized subtilisin, which has a direct fibrinolytic property. In the instruction for medical use of the drug Trombozim, there is no information about its effect on the coronary blood flow. Since the drug is positioned for the treatment of cardiovascular diseases, we were interested how the immobilized subtilisins has an effect on the coronary blood flow. Test substance. The subtilisins are proteolytic enzymes from the hydrolase class produced by Bacillus subtilis bacteria. The subtilisins are immobilized on polyethylene oxide using access technology. The thrombolytic effect of immobilized subtilisins has already been studied. The aim of this work is to study the influence of immobilized subtilisins on the coronary flow. The Langendorf's method of the isolated mammalian heart is optimal for studying the effect of immobilized subtilisins on coronary blood flow. This experimental model allows to study in detail the physiological and biochemical processes in heart, as well as external influences on it, in the absence of systemic neurogenic and humoral factors. In experimental groups, after 20 minutes of perfusion, against in the background of stable cardiac work, the calculated dose of immobilized subtilisin is injected into the glass with the perfusion solution. The glass with the perfusion solution, you can see the number 2. The moment of immobilized subtilisin administration is designated at the point 0 minute, which the coronary flow is considered as the initial flow is taken as 100%. Further perfusion with the study drug is continued for 40 minutes. Coronary flow changes are recorded at the 5, 10, 20, 30, and 40 minutes. In the control group, from 0 to 40 minutes, the perfusion is performed with the Krebs Henselate solution. The study design. The experiments were performed on the 50 male West rats weighing 300 grams. The animals were divided into 5 groups. The control group, the hearts were perfused with the Krebs Henselate solution, and the experimental groups, the hearts were perfused with immobilized subtilisins at the first concentrations. The concentrations you can see in this slide. The first dose you can see on this picture. In the group control, you can see their hearts were perfused with Krebs Henselate solution. We noted an increase in the coronary flow from 5 to 30 minutes, and the increase was maximum 10%. Then there was a smooth decrease to 7% of the baseline. In experimental group 1, you can see there were no significant differences with the group control, but there was a great increase of the coronary flow at the 20 minutes of perfusion. The second group, we noted that from 5 to 40 minutes, we can see the significantly increased in the coronary flow, reaching at maximum at the 20 minutes, and it was 23% compared with the group control. In experimental group number 3, we observed an increase to 4% in the coronary flow by the 5th minute, and then we observed a significant decrease in coronary flow from 10 to 40 minutes of perfusion by 10% relative to the group control. In the group number 4, we observed a gradual decrease in coronary flow from 10 to 40 minutes by 12% relative to the group control. The maximum decrease in the coronary flow was noted at 30 minutes of perfusion. Conclusions. On a model of an isolated red heart, it was shown that with the perfusion of immobilized subtilisins at doses of 170 and 340, an increase in coronary flow is observed, and accordingly the vasodilating effect of immobilized subtilisin. At the dose of immobilized subtilisin 500 and 1000, there was a decrease in the coronary circulation, which indicates an increase in the contractile activity of the coronary vessels. The phenomenon of vasomotor activity of immobilized subtilisin has been established in relation to the coronary vessels. In modern physiology and pharmacology, there is no information about the presence of specific receptors for the immobilized subtilisins in the coronary vessels. The study of this mechanism is planned in the follow experiments. Thank you for your attention.